I do want to add before Dr. Ossoff begins that UAB Medicine's urgent care is open to take care of your non-life-threatening illnesses and injuries. However, due to the high demand for COVID testing, long wait times can be expected. The clinic is located at 125 20th Street South, Suite 103 in Birmingham, and we will provide that info in the chat as well for media to share with the audiences. One other note, if you're experiencing mild COVID symptoms, please call the Jefferson County COVID-19 call center at 205-858-2221 or visit the Alabama Department of Public Health's website at alabamapublichealth.gov, and we'll provide that in the chat as well. Dr. Ossoff will begin with a couple of opening comments for you to just provide some details on our ambulatory clinics. And so for the media, please hold your emergency department related questions until we're set up with Dr. Lewis. So Dr. Ossoff, let you take it away.
Thank you. Yeah, this message is in regards to our outpatient ambulatory clinics and what we're going to be doing temporarily to try to keep people safe. So due to the COVID public health emergency and the increasing number of cases that we're seeing nationally, but also even locally due to the Omicron variant, we are asking for ways to keep UAB medicine safe for its valued patients and caregivers, as well as our trusted providers. And so with that in mind, we are asking the following patients to not come in person. Those include folks with symptoms such as fever, cough, shortness of breath, body aches, a loss of taste or smell, but also those with sinus congestion or a sore throat. Those that also have a COVID test that's pending, if they've had a COVID positive test in the past 10 days, or if they've been in close contact with someone with COVID in the past 10 days. Again, we're asking for all of those patients to please not come in person, but rather to convert those visits to a telehealth video visit or to ask for a different appointment later on that they can do in person. So they could call their physician directly and have their appointment changed to a telehealth visit or to change their visit to an in-person appointment later on. With increasing COVID positivity rates, if you are concerned and want to go ahead and change your visit to a telehealth visit, please go ahead and do so, or you can also schedule your visit later on, even if you don't meet any of those 4 criteria. I'm happy to take questions from here. Thank you.
Okay, as we're waiting for questions, Dr. Ossoff, how, you may have already mentioned this, but again, for those who are just joining us, how long will this new arrangement last?
Yeah, it's a great question. Right now, we're hoping to do this through the end of January, where we hope that the spike that we're currently seeing in COVID cases will start to come down. We'll provide an update later this month if anything changes.
All right, thank you. And does this affect the hospital as a whole or the emergency department at all?
Currently, this is for outpatients, so those in our ambulatory clinics outside of the hospital. So again, this is not in the hospital or the emergency room.
Does this affect the clinics outside of Kirkland or Whitaker?
Yes, this would affect our ambulatory clinics in all of our clinic locations right now, which would be considered, as we said, our ambulatory or our outpatient clinics, those outside of the hospital, correct.
Okay. Will exceptions be made in cases of essential treatment such as chemo or anything like that?
Yes, if you have a certain circumstance like you're describing, someone with cancer or someone who needs chemo treatment, we can make exceptions. If you feel like you fit any of those categories, feel free to call our offices and we'd be happy to guide you and direct you appropriately.
Obviously, during the height of the pandemic, many patients had to resort to telehealth. But for those who may not have a smartphone or a smart device, what are the options for patients who do not have the access to that type of technology?
That's a great question. Our telehealth program at UAB is fantastic. There are lots of ways to get in touch with your provider through telehealth. We do have the telehealth video visits, but we also have telehealth phone visits for those that are unable to connect. And we'd be happy to work with you to find the most appropriate way to connect with your provider.
All right, thank you. We'll keep you here for just a few minutes. I know you have to have a hard stop around 1:45. So, but before that, let's bring in Dr. Bobby Lewis, who's just joined us. Dr. Lewis, can you provide just an insight as to what UAB is experiencing with its emergency department and what people should be doing and when should they be coming to the emergency department?
I'll be glad to do that. Right now, just a few minutes before I came down here, I looked at our numbers, and in our 3 emergency departments, UED, the main emergency department, Highlands, and the Gardendale freestanding emergency department, we have more than 2.5 times as many patients as we can adequately take care of at any one time. So obviously people who are coming can expect a wait to get seen. Certainly people who are critically ill, have serious medical problems, illness, injuries are going to get seen more quickly than those with less worrisome circumstances. This also holds true to almost every emergency room around town. This morning I've been in touch with several of the medical directors in other emergency departments, and pretty much every single emergency department is facing the same situation that we are, with more patients that they can comfortably take care of in a quick manner, and not being able to get patients admitted to the hospital quickly and easily. Just as we've heard a few minutes ago from Dr. Irf, we would encourage people who have minor symptoms, things that can be more appropriately taken care of at home, not to come to the emergency room. And certainly do not come to the emergency room if you just need a COVID test. EDs are not the appropriate place for getting COVID tests, and there are a number of other sites that can be done more appropriately and adequately. Again, we don't discourage anyone who feels like they need to be in the emergency room to come see us. We will be there, we will see you, but understand that the whole situation, the numbers that we're seeing, and the widespread value of what we're seeing from the COVID is taxing all of the emergency departments. One of the things we're stressing to every patient that we see is, if you are not vaccinated, get vaccinated. If you've had boosters, great. If not, you need to get a booster, because that provides extra protection. And certainly with any activity that you're doing, it's best to be wearing a mask, social distance, and don't do anything that you shouldn't absolutely have to do.
All right, thank you, Dr. Lewis. All right, that's fine. No problem. One question we have submitted is for Dr. Lewis. How many people were showing up to the ER recently looking for testing?
Quite a few are. They feel like they just need to be tested. They need to know whether they have COVID or not. What we're encouraging folks to think is, if you have symptoms of COVID, assume that you have it and treat yourself just as if it is COVID. Social distance, wear mask, quarantine for the 5 days that the CDC recommends before you go back to normal activities. And we're certainly encouraging folks to go to other emergency departments to get, or not emergency departments, but other more appropriate locations to get testing if that's all they need.
All right, thank you. This question may be for either of you, so whoever is who wants to answer, that's fine. What should those that are needing pre-procedure testing, what should they be doing?
I think Dr. Irf may be able to answer that better, but that can be done at testing centers or physicians' offices. Typically, when people are coming for procedures, the office will arrange to have that done or direct a person where to have it done.
Correct. Yeah, if you're having a procedure done at UAB, they will guide you on the testing, on where to go for testing and what would qualify.
All right, thank you. Next question. Many people can't find a COVID test and may be resorting to the ED for one. What is, what are the alternatives to getting a test?
Well, there's still a number of testing sites. Most of the pharmacies have tests, and a number of testing sites where people can go. Those are listed on the internet for folks that have internet service. If you call almost any of the hospitals, they can direct you to a testing site.
And I think when we opened, we talked about having people go to the Jefferson County Department of Health or the Alabama Department of Health website to be able to access where the testing locations are.
That's great. Thank you. We'll put that in the chat for media as well. This is a question maybe both of you can answer. We've heard that this is the most contagious strain so far. Can you compare what you are seeing currently to other surges that we've had in the last year and a half, 2 years?
Yeah, I can start. Definitely with this variant, there is the possibility for serious disease, but at the same time, we are seeing some milder symptoms as well. That's where symptoms such as a runny nose or sinus congestion and a sore throat can still be symptoms of the Omicron variant. I think that makes it even more challenging because sometimes people don't recognize that they may have symptoms, and that may help with increasing the spread in this particular variant as compared to others.
And I would certainly agree with that. As I mentioned earlier, if you have those symptoms, you should consider yourself to be COVID positive and treat yourself as if COVID positive until you get testing. And realize, as Dr. Irv said, this strain does not appear to be as virulent and cause as bad a disease as in the past, but we're just seeing many, many, many more cases of this than we have the others when they come through.
All right, thank you. Dr. Lewis, I'll ask you this question. Since you've kind of alluded to it earlier, can you talk more about the strain that hospital systems and emergency departments are facing right now? This reporter says, I understand there is an unprecedented amount of healthcare workers out dealing with COVID.
That's correct. This is the Omicron variant that we're seeing. If you remember, this just got started in the United States just a few weeks ago. And even now, in this short period of time, we're seeing many, many more cases. We've got a number of hospital employees that are out with COVID. In our emergency departments and other places in the hospital, we're encouraging folks to wear surgical masks or N95 masks with any patient contact, and doing all the usual things that we do to try to protect ourselves. Many people have gotten infected.
All right, thank you. Dr. Asif, obviously we're still in the middle of flu season. What about flu testing? What are you recommending for people with flu-like symptoms? And, or, at the end of your comments, Dr. Asif, can either of you discuss this new flu Rona type variant that has been discovered in Europe?
Yeah, that's a great question in terms of the flu. A lot of the symptoms overlap with COVID. So we talked about the symptoms to watch for with COVID, such as fever, cough, shortness of breath. Body aches are typical with both the flu as well as COVID. You can have a runny nose, a sore throat. So the symptoms overlap quite a bit. Right now, I think if you have either symptoms for the flu or COVID, I would currently stay away and do a telehealth visit and let your provider try to help you figure out which of the two that you might have. In many testing locations, they include COVID and flu testing, and oftentimes include strep testing as well, to help you to distinguish between the two. Symptom treatment for both is oftentimes symptomatic unless you have certain comorbidities, but your provider will be able to help you walk through that.
And I don't really have anything to add to that. We routinely in the emergency department, if we're testing patients, we'll test for both flu and COVID at the same time and recommend the same treatment for each of those in general. Again, if you're not tested and you don't know which you have, I would assume that it's COVID, and that's what you should do to take care of yourself and protect others.
Thank you. Are there any other questions from media while we have Dr. Asif here for the next maybe 5 or 10 minutes, or Dr. Lewis? kind of do a last call for questions here. All right. Oh, here's one. What should you have at home to take care of yourself if you have COVID symptoms?
Yeah, I can start with that one. Many of the times with these viral illnesses, you get dehydrated fairly quickly, particularly as your body temperature goes up. So making sure that you have adequate fluids, hydration through water, but also electrolytes will be good for you. So maintaining hydration is really important. You can take symptomatic treatments. So for a headache, think about Tylenol. For body aches, you might use Advil or ibuprofen, but make sure you take that with food. So oftentimes we try to treat people symptomatically. And again, hydration, over-the-counter medication can be helpful. And then beyond this, I think I would work with your provider on other treatments if you need them based on the symptoms that you're feeling.
And I would agree with that, certainly the same medications, and many of the folks who have these symptoms also just feel very exhausted. So it's helpful to get as much rest as possible. I know sometimes with family activities and other things, it's almost impossible to do that, but rest is useful also.
All right, thank you. Dr. Lewis, one clarification question that they ask, are you recommending people not necessarily get a COVID test, but assume you have it if you display symptoms? What's your guidance there?
If it's convenient to get a COVID test, I would certainly do that. But again, not knowing which you have, assume that it's COVID and take those precautions that we recommended in lieu of getting the test.
Okay. Not seeing any other media questions. I think we will wrap things up there. Again, if you are experiencing mild COVID-19 symptoms and you are looking to be tested, please call the Jefferson County COVID-19 call center at 205-858-2221 or visit the Alabama Department of Public Health's website at alabamapublichealth.gov for a full listing of testing sites. And then for emergencies, please visit your nearest emergency department. So thank you again, Dr. Ossoff, Dr. Lewis. Thank you for your time and have a great day, everyone.